The solution: Family Care, America's alternative choice for affordable health care. In 1983, a group of physicians in Houston, Texas decided they wanted to help preserve the doctor-patient relationship by giving their patients an option. Family Care is a national discount medical plan organization that offers low-cost, high-quality healthcare services. As the originator of medical discounts and savings programs, over the past 26 years, we have saved many families thousands and thousands of dollars on medical bills, prescriptions, vision, dental, chiropractic, and more. The company is licensed and registered in every state that requires a license and registration. As a matter of fact, there are 20 states now that require licensing for these type of programs. Currently, as of 2009, the only company in the United States licensed in every state requires a license is Family Care. In the state of California, the Department of Managed Healthcare, which regulates HMO insurance companies and managed healthcare plans, since 1975 has placed a law called the Knox-Keene Health Plan Act of 1975. For 34 years, no company has ever been granted a medical DMPO license in the state of California until now. On June of 2009, the Department of Managed Healthcare licenses their first medical discount health plan in California. Uninsured consumers needing relief from high healthcare costs gain major protections. The California Department of Managed Healthcare has announced that Association Healthcare Management, Inc., doing business as Family Care, has become the first medical discount health plan to be issued a license to operate in California. The license is initially valid for 24 months. As of this recording, we are the first and only company with this license in the state of California. Offer, as we said, limited group insurance benefits that kick in 30 days from the time that you enroll. But initially, upon enrolling, what you're really joining is an association benefit plan. Through this association, you now become a member and get access immediately to savings on preferred medical pricing, including not only physicians, but specialists as well. Pet care services, eye care services, hearing services, patient hospital advocacy. We also offer prescription discounts, comprehensive blood tests, dental services, a nurse hotline 24 hours a day, 7 days a week, toll free, wellness, credit union services, legal services, provider relations, and a $20 generic prescription drug card that gives you medications that if they're less than $20 will be less, but if they're more than $20 you will not pay more. Now folks, 30 days after you're a member and get access to the discount savings, immediately after 30 days, the limited group insurance benefits kick into place and no one is denied. Everyone is accepted. This 30 days, the first benefit is a $50 benefit per doctor visit 4 times per year per family member. So that's 4 for the primary member, 4 for the spouse, 4 for each child, no matter how many children you have. It will include children up to the age of 25 and adults up to the age of 70. Now, folks, here's an example of how it works. Let's say you have a doctor visit that normally costs $90 to $100, and you go into our network price. And let's say that the network price is about $60, and of course it can be less or it can be more. Well, the insurance benefit will now reimburse you $50 for that doctor visit, so your cost is only $10 for that doctor visit. In some cases, the actual doctor visit may be less than $50 in network. Let's say, for example, it's $35 or $40. You pay that, get your receipt, and get one of the super bills from the doctor's office, file a claim with us, and the insurance carrier will send you a $50 check in the mail. Now, folks, what if your doctor doesn't accept this? Just like some insurance plans, there's some doctors that don't accept some certain insurance carriers. Well, if that happened with us, go ahead and pay the amount of the visit, get a receipt, get a super bill, file a claim with us. We still will send you the $50 4 times per year per family member. So it works with any physician, whether you go in network or out of network. Now, if you haven't used your 4 visits per year with this group insurance benefit, let's say you've only used it once or twice, but you have to go to the dentist. Right now, we contract with Aetna Dental. We have over 70,000 dentists nationwide. Now, folks, we have also a $2,000, $5,000, and $10,000 per accident injury benefit. I've only shown you the $2,000 benefit here because that's the minimum you would get. But we have a couple other plans that I really love to sell that also have a $5,000 and $10,000 per accident injury, and that's per family member per accident. So let's say, for example, that you have the $10,000 accident injury benefit and one of your family members has an accident and you go to the hospital. And let's say that the bill was actually over $10,000. With our PAC department, our Patient Advocacy Center, we can knock that down below $10,000, and you'd be responsible for a $100 deductible, and the group insurance benefits would pay the rest of the amount directly to the hospital. And folks, you can use any hospital in the country and actually any hospital in the world. The next benefit is $10,000 accidental death and dismemberment, $5,000 coverage for the spouse, and $2,500 of coverage per child. And it covers adults again to age 70 on the group insurance benefits we've just talked about, and children of the age of 25. The next benefit is a $100,000 worldwide emergency travel assistance. If you're over 100 miles away from home and get into a severe tragic accident or something occurs that you need to be flown to a hospital, that can cost $20,000 to $30,000 or more. This will provide $100,000 of benefits for each member underneath this benefit. Now, the primary and spouse are covered up to age 80 with this benefit and up to age 25 per child. Now, folks, these are some other additional benefits I'm going to mention in one of our other plans that also includes pet care. It also includes a $20 generic prescription drug card, as we mentioned earlier. It also has $10,000 level term life insurance, and the spouse is covered for $2,500 and each child for $1,250. Now look at this, folks. After 30 days, as I said before, this is guaranteed issue. There are no labs needed, and the primary member is covered up to age 85, level term, and the spouse is covered up to age 70, and legal children up to the age of 25. And folks, I forgot to mention that for our clients, there are no social security number requirements. So all these benefits. Now, of course, some of these benefits are in some plans and not in other plans, so make sure that you get together with the person who showed you this to see which plans have what benefits. And I'll give you an example in the next slide. These are just 3 of over 40 different plans that we have. That Care Deluxe 2 program that we just mentioned has many of not only of the discount benefits, but after 30 days, it includes the group insurance benefits, and as you see, it's $79.95 a month for a single person. If they live in Texas, it's also a one-time $60 application fee. Outside of Texas, it's a $100 fee. And of course, they'd pay both those fees, or one of those fees, along with the first monthly dues. The following month, they would just pay the monthly dues. There are no contracts. You can cancel any time. Now, folks, the price for a family is exactly the same price as for a single individual, $79.95 a month for a single person or a family. That's a tremendous value. Now, if you look at the next plan, the Health Choice 2, that had the 3 extra benefits that we talked about on the slide, which was the pet care, the $20 generic prescription drug card, and the $10,000 term life insurance. Now, but if you're just a younger person, a younger couple, or a younger family, I'd rather sell them the Premium Choice plan for $109.95 a month with a $60 fee if they live in Texas, or a $100 fee if they live outside of Texas. And the reason why is it doesn't have the $2,000 accident injury. It has a $5,000 accident injury, as you see in the bottom of the slides here. And what's neat about that is, as you can see, the $5,000 accident benefit is included with the Premium Choice, as we said earlier. It does not have the $10,000 term insurance. So I would sell this one to a younger couple or younger family who are looking more for the $5,000 accident benefit. So that's pretty neat. Now, for the states that we cannot sell those plans, as you saw earlier in the slides, we have 2 other plans that could be sold in the states that we cannot sell the other plans. Now, these are called our plans, and the reason we're called our, that stands for American Workers Association. The monthly dues for both of these plans are $89.95 a month, and again, a one-time $60 fee in Texas. Now, it includes not only the discount benefits for the first 30 days, but right after 30 days, it has the group insurance benefits. What I like about the OptimaCare, it does not have the $2,000 accident injury, but it does have the $10,000 accident injury. And folks, that's the highest benefit for an accident in any of our plans. The next plan, the Premier Select, again, is great for people who are looking for more of the term insurance versus the accident injury. Again, for the the older couples out there who are looking for some type of final expense benefit. But besides the $10,000 term life insurance that's included in that plan, it also has the $20,000 accidental death and dismemberment. So if someone died with the Premier Select plan because of an accident, that's $20,000 plus $10,000 of benefits to the beneficiaries if it's the primary member. So, some pretty good benefits here for a very, very affordable price. The only difference in these plans is it does not include the Aetna Group dental plans as it does in the other plans in the prior page.